Hello, I'm Dr. Nadine Gauthier, cardiologist at the Ottawa Hospital. Today, I would like to raise awareness about a very common heart condition, coronary artery disease. This form of heart disease is one of the most common causes of death worldwide on a yearly basis. This common disease could affect you or someone you know. I would like to spend a few minutes on this potentially life-threatening condition when not recognized early. So let's learn more about coronary artery disease, including the associated symptoms, diagnosis, and treatment. The most important question is, what is coronary artery disease, or CAD? Coronary artery disease is also known as atherosclerosis. It is the aging process of the arteries of the heart. It becomes more serious as there is progression of plaque buildup within the arteries to eventually cause a blockage, also known as a stenosis, impeding the flow of oxygen-rich blood to the heart muscle. It is initially a benign process, not associated with symptoms. Over time, and without treatment, a blockage is formed leading to symptoms of chest pain, also called angina, and in more acute cases, could lead to a heart attack or myocardial infarction, which can be fatal. Patients may present differently, but the important symptom to recognize is chest pain or chest pressure triggered by either physical activity, emotional stress, or with eating. There are two forms of variables that increase the risk of coronary artery disease. Firstly, we find non-modifiable factors, such as the gender of the patient, more common in men, and family history at a young age. There are also modifiable risk factors, including smoking, physical inactivity, and specific health problems, such as hypertension, diabetes, or high cholesterol. Many patients have multiple of these risk factors, which increases their likelihood of developing coronary artery disease. Early-stage coronary artery disease can be difficult to detect, as most patients will not have symptoms initially. Some early warning signs might include chest pain, triggered by the 3 E's, exercise, emotion, or eating, is also called angina. The chest symptoms are often accompanied by breathlessness and fatigue. In certain cases, coronary artery disease results in a more severe presentation, such as a heart attack, which presents as a severe chest pressure at rest with shortness of breath, severe sweating, nausea, or vomiting. Diagnosing coronary artery disease necessitates a comprehensive diagnostic approach. There are many different types of tests to diagnose CAD. To quantify the extent of arterial obstruction and guide treatment, most physicians will start with an electrocardiogram, or ECG, blood tests, and an echocardiogram, which is an ultrasound of the heart, stress testing, cardiac CT scan, and invasive procedures like cardiac catheterization, a procedure in which a catheter is moved through a blood vessel to the heart. The treatment options for coronary artery disease depends on the patient. Lifestyle modifications are mostly important to delay the progression of atherosclerosis and prevention of arterial blockages. The cornerstone of management includes a combination of cardiac medications targeting blood pressure, cholesterol using statins, and clotting mechanism such as low-dose aspirin. In severe cases, treatment might include invasive procedures to restore proper blood flow, like coronary angioplasty and stenting, or in more severe cases, open heart surgery with coronary bypass surgery to offer restoration of proper blood flow and oxygenation to the heart muscle to prevent recurrent chest pain. Following these cardiac interventions, patients often become asymptomatic again and can resume their previous activities and regain the same quality of life. The best way to prevent coronary artery disease is to adopt a heart-healthy lifestyle that includes regular physical activity, a balanced diet, stress management, and abstinence from tobacco. Preventing and managing the cardiovascular risk factors will lead to less CAD and coronary stenosis, also known as blockages. As in most chronic health conditions, prevention and knowledge are the keys to success in achieving a heart-healthy life. This was a very brief and high-level summary on coronary artery disease, but I hoped it helped you to better understand this condition and that this information will empower you to commit to your own cardiovascular health, as it all starts with you. Stay heart smart, live heart healthy. I'm Dr. Gauthier from the Ottawa Hospital. Thank you for watching.